I get a call at the hospital that says they're evacuating the surgery center. As I get over to the parking lot, there are patients everywhere.
It's pretty much a little bit of a chaotic scene. You've got people who thought they were going to be in a recovery room. They're laying in their beds in the parking lot. They open their eyes for the first time and they see clouds. They think they've gone to heaven. This lady walks up to me and says, "Are you in charge?" And I said, "Well, no, ma'am, I haven't assessed the situation yet, but I'm the fire chief." And she says, "Well, that's who I need to talk to. My name's Deborah, and I'm the director of nursing, and you have evacuated my surgery center." She saw a parking block. She climbs up on that parking block so she can look me square in the eye, and she chews me up one side and down the other about evacuating her surgery center.
He swears I got up on the curb so that I could look him eye to eye to tell him about evacuating my surgery center.
I ran into my deputy chief a few minutes later and he said, "Hey, did you run into so-and-so?" I said, "Well, I appreciate you warning me about him, but why didn't you tell me about Deborah?" And we laughed about that. Deborah came back over a little while later and we came to a good understanding. And that developed the relationship that we've enjoyed for so many years, because she would bring people in this community and people in public safety and people in the healthcare system together to work through whatever was coming.
She has played a vital role in so many ways at Tanner Medical Center.
She's always made sure that whatever units that she was in charge of, be it an entire hospital or 3 hospitals, that they were prepared.
Her fingerprints are all over this hospital and the processes and the leadership. But more than anything, she created this culture of decision-making and decisiveness. She has more knowledge of this health system, nursing administration, and just clinically, just a great understanding.
She has done remarkable things, from being a charge nurse to heading a department such as pediatrics, to going on to serving as an administrator in Villa Rica, and going on to being the top administrator in Villa Rica, and then finally ending her career as the administrator of Carrollton. She has played a vital role in so many ways at Tanner Medical Center.
In high school, I didn't really know what I was going to do, and I just always grew up thinking I would probably be a teacher because that's the only professionals I knew. When I was a senior in high school, I got dehydrated and had to be in the hospital a few days. The nurse came in and she taped my hand to a Kleenex box, and then she started an IV in my hand. And I just thought that was just the coolest thing I had ever seen. And so that's how I became a nurse. I went to work in my first position in a small hospital in my community. It was a little 48-bed hospital. You start out orienting as a new graduate for the first 3 months. I called and said, "Hey guys, I got my license today." And so you get there for your 3 to 11 shift and everybody just disappears and you're the only RN in the hospital. It's sort of sink or swim and you just learn how to handle things.
It was just obvious to all leadership that Deborah knew how to handle difficult situations. She knew how to think on her feet, and that just opened the door for more opportunities for her.
In nursing, you're affecting one life at a time, so I moved into leadership so that I could make a difference. I felt like in a leadership position that I could affect the lives of many patients through the staff that I would be leading.
I met Deborah when she came here about 40 years ago. I really came to admire her work ethic. I moved to Villa Rica to be the administrator for the hospital there. I knew I was going to need a new director of nursing. Deborah was the name that I had in my mind. She said, "Oh, I'd love to do that." So she came to Villa Rica.
So I was working on my master's degree in healthcare administration at the time we were thinking about building the new hospital. So then when I was involved and was learning and doing the research and the design and the working with the architects, it was about time for me to do my last paper in my master's program. So I did it on the research and design phases of building a new hospital.
Deborah's role with the contractors, electrical, plumbing, architectural, everyone would tell you that she was invaluable.
I was involved from the first drawings that we made on a flip chart with some of the doctors as to what we wanted that new facility to be, all the way through construction meetings every week. So I learned a lot through that experience.
I don't think the facility would have functioned as well as it did through patient flow and visitor flow if Deborah had not been there and performed those duties.
That was a once-in-a-lifetime opportunity to be that involved in building a new hospital. And it being a small facility, we were able to involve the staff, and so they made a lot of the decisions and participated as well. Becoming the administrator at Villa Rica, it's something I never had thought about doing in my career. I knew everybody in the hospital. We were like a family. So to be able to lead that group, it was just easy to do because they made things happen. They made my job easy. They made me look good every day. Larry Steed had become the chief operating officer for the entire system, and his office was in the Carrollton facility.
Some things changed here in Carrollton, and I needed a highly qualified professional administrator down here. And so I called her one day and told her, I wanted her to think about coming down here. And I knew she liked her job at Villa Rica, but I asked her to just think about that. I was probably not as direct as I needed to be.
Went home, thought about it over the weekend, so I called Larry back and said, I'm happy what I'm doing, so if it's okay, I'll just stay in Villa Rica.
So I called her back and I said, you know what? I thought about your answer, and you didn't give me the right answer. So let me tell you what the right answer is. The right answer is, yes, I'll be happy to come down there and fill that job. And she said, okay, if that's what you want me to do.
So less than 2 months later, I was in Carrollton as the administrator.
You can't look at a career in nursing or in healthcare today without reflecting on probably the greatest challenge any healthcare organization has ever been in, and that is the COVID pandemic.
I could have worked another 47 years and done without the pandemic. That was the most challenging time of my 47-year career.
So the complexity facing nursing leadership was dramatic. And she, while stressed and impacted by it, she did not waver.
When she would just walk into the room, you could tell it was a common force. You could tell that Deborah had the situation under control, and that just speaks volumes to me, that when somebody walks in the room, they kind of take control just by their presence.
We're so blessed to have had her leading nurses through one of the most difficult times that any of us will ever probably experience, and that is the COVID pandemic.
I probably would have retired 3 or 4 years earlier, but the way things were going, we had rolled out Epic, then the COVID and the pandemic hit, and so then we got approved for the open heart, and we had waited for that so long that I just pushed my retirement back, and I didn't want to retire until I saw us do our first open heart case. We did our first case in January, and my team knew that we would not be what held up the open heart program if it did not happen in January. So the teams did an awesome job, so we're very proud of that. With my son's chronic illness, I realized that families live with these things 24/7. It's not just while they're here in the hospital, and providing them support and answering their questions and helping them is just so important. I'm very humbled and appreciative of this recognition. It's sort of like the icing on the cake or the cherry on top of the sundae for my retirement. I've had a very long and successful career, but a successful career is not a solo act. A successful career is built through the people that mentored you and all of the people that you worked with throughout your career. And those people are truly the healthcare heroes. And to them, I say thank you. And I have been truly blessed.
The Lifetime Achievement Award, no one more deserving. She has spent her life in nursing and nursing administration, and it is a lifetime of success in those endeavors, so none better, absolutely none better.
There's nobody more deserving than Deborah Matthews. She has taken care of the healthcare system, and she is a premier leader. There is no other way to say it.
If you want to look at what she has invested in her career and the benefit that has come from that to this health system, this community, and the positive image that helps foster for the Georgia Hospital Association, I can't imagine anyone being more deserving.
Deborah, I'm so incredibly proud of you, and you are most deserving of this Lifetime Achievement Award. I can't think of a better way for you to end your amazing nursing career.
Executives like Deborah Matthews don't come along every day. She left our organization a better organization because of her service to Tanner and to nursing. And for that, we will be always so grateful.